What tests are available to diagnose the cause of postmenstrual bleeding?
Hello, and welcome to our video on diagnosing the cause of postmenstrual bleeding. Postmenstrual bleeding, also referred to as intermenstrual bleeding or spotting, can be quite alarming for many women. But don't worry, numerous diagnostic tools and tests can help identify the root cause. In this video, we'll walk you through these essential tests. Remember, early diagnosis often leads to more effective treatment and management.
What is postmenstrual bleeding?
Before we dive into the tests, let's clarify what we mean by postmenstrual bleeding. Postmenstrual bleeding refers to any bleeding or spotting that occurs between periods or after menstruation has ended. It can vary from light spotting to heavier bleeding and can occur for many reasons, such as hormonal imbalances, fibroids, polyps, or more serious conditions like endometriosis or cancer.
Initial consultation and physical examination.
The diagnostic process usually starts with a comprehensive medical history and a physical examination. Your healthcare provider will ask about your menstrual cycle, symptoms, medical history, and lifestyle factors that could contribute to irregular bleeding. A physical examination typically includes a pelvic examination, where your healthcare provider will check for any physical abnormalities in the uterus, cervix, or vagina that could be causing the bleeding.
Pap smear and HPV test.
Your healthcare provider may also conduct a pap smear, which involves collecting cells from your cervix to screen for cervical abnormalities, including precancerous or cancerous cells. An HPV, human papillomavirus, test could be conducted simultaneously, as some types of this virus are known to cause cervical cancer.
Ultrasound scan.
To get a detailed look at your reproductive organs, your healthcare provider may recommend an ultrasound scan. This non-invasive imaging test uses sound waves to create images of your uterus, ovaries, and cervix. It can help identify structural abnormalities such as fibroids or polyps that might be causing the bleeding.
Endometrial biopsy and hysteroscopy.
If the cause of bleeding is still unclear, further tests might be needed. An endometrial biopsy is a procedure where a small sample of the lining of your uterus, the endometrium, is taken for analysis. This can help identify issues such as endometritis, inflammation of the endometrium, or endometrial hyperplasia, abnormally thick endometrium. Hysteroscopy involves the insertion of a small camera through the cervix into the uterus. This allows the doctor to visually inspect the interior of the uterus for any abnormalities that may be causing the bleeding. In conclusion, diagnosing the cause of postmenstrual bleeding involves a comprehensive approach that may require several different tests. Always consult with your healthcare provider if you're experiencing irregular bleeding or spotting. Early diagnosis and treatment are essential for maintaining your reproductive health. We hope this video has been informative and helps you feel more prepared for any conversations with your healthcare provider. Stay healthy and take care.